Hello, and thank you for your interest in learning more about the live kidney donor process. This video will provide an overview of the medical, surgical, psychosocial, and financial considerations you need to be aware of in order to donate your kidney. This video will also provide information about the surgical procedure, recovery, and required follow-up if you donate. On average, about 6,000 people each year become living kidney donors in the United States. In general, live kidney donation is a relatively safe procedure, but like all surgeries, there are associated risks. Some risks are expected and considered minor, such as pain, a surgical scar, fatigue, or other symptoms like bloating and nausea. Additional potential risks can be more severe, such as wound infection, bowel obstruction, hernia, blood clot, pneumonia, or nerve injury. Though extremely rare, in some cases you could experience kidney failure and need dialysis immediately after donation. This could be short-term, most common, or permanent. When these rare events occur, current policy gives living donors priority on the national waiting list for a kidney transplant. As with all types of surgery, death can occur. The risk for disease or death as a kidney donor could be impacted by factors such as age, high blood pressure, obesity, or other medical conditions. The team will discuss these factors that could affect you. There are potential psychosocial risks after donation. These risks include problems with how you feel about your body or what it looks like, changes in your lifestyle, problems with depression, fear, stress, anxiety, or feelings of sadness if the transplant recipient becomes ill or dies. Your transplant recipient's recovery might not be as expected. For example, the kidney transplant may not work right away, or new medical problems could arise. In rare cases, the recipient could even die. The chance of these things happening to your recipient may be higher than compared to other transplant candidates. The transplant team considers the recipient's risks when determining transplant eligibility and may determine the benefit of transplant is greater than the risk of dialysis. Unless the transplant candidate agrees, their medical information is confidential and cannot be shared with you. Each transplant program chooses potential donors and transplant candidates based on their own guidelines, practices, and judgment. The transplant team not only takes into consideration your health at the time of donation, they also consider how donation may impact your future health. Here are some things to consider. On average, you will permanently lose 25 to 35% of your kidney function after donating. Although this may sound like a lot, one healthy kidney can work just as well as two. Your risk of having kidney failure later in your lifetime is not any higher than it is for someone in the general population of a similar age, sex, or race. However, you are more likely to have kidney failure than healthy people who are not donors. If you are a young donor, 18 to 40 years old, determining your likelihood of developing chronic kidney disease or kidney failure later in life is harder to predict. Chronic kidney disease, if it occurs, often starts in the middle of your life, 40 to 50 years old, and may not progress to kidney failure until after age 60. For women who donate and become pregnant afterwards, the risk for conditions known as preeclampsia and gestational hypertension, high blood pressure during your pregnancy, are increased. If you damage your remaining kidney that you do not donate, you may be at higher risk for developing chronic kidney disease, which could transition into kidney failure. If this occurs, you will need medical treatment such as dialysis or transplant. You will also need to take into consideration how the kidney donation as well as potential complications could affect you financially. Here are some things to consider. Living kidney donors should have annual checkups. The donor may be responsible for these costs. You will be required to take time off from work for the surgery and recovery. This could potentially result in loss of income or employment. You may have potential restrictions on acquiring future employment. You may have difficulty obtaining, maintaining, or affording health insurance, disability insurance, and life insurance. If you experience future health problems, these may not be covered by the transplant recipient's insurance. Although there are many important aspects to consider, remember, you have a transplant team and living donor advocate to answer your questions and address any concerns. Your surgeon will determine the best surgical approach to remove your donated kidney. Nearly all living donor operations are performed laparoscopically. It is a minimally invasive surgery that uses small incisions to remove the kidney with the help of a special camera called a laparoscope. Your surgeon will discuss with you prior to the surgery which method will be used and go over the risks involved. After surgery, you can expect to spend 1 to 2 days in the hospital. The recovery period after donation is different for every donor. On average, it takes 2 to 6 weeks for recovery. The transplant team will provide instructions on things to avoid during your recovery. These include lifting heavy objects, strenuous exercise, and driving. Donors must agree to participate in follow-up care. This care is conducted shortly after your surgery, around 6 months, 1 year, and 2 years after donation at the direction of the transplant team. Follow-up care may include physical examination, laboratory testing, and health screening questionnaires. This care is necessary to monitor your health and provide medical treatment if needed. During this follow-up, like any medical checkup, if an infectious or sexually transmitted disease is discovered, the hospital may need to report it to local, state, or federal health authorities. Additionally, disclosure to the transplant recipient's hospital may be required. Your information will be kept confidential unless otherwise required by law. At the end of your 2-year follow-up with the transplant team, you should continue to see your primary care physician on a yearly basis. If you or your primary care physician have concerns related to your donation at any time, our team is here to help.